Hey guys, this is Zach from EC Education. I got Helen with me, and she's going to be showing us how to do an arterial line. We're going to do this in two parts, so that way we don't bore you. I know, right? This is one of the number one things I get asked on a daily basis. So we're going to go through some Q&As and show you how to set up an art line. All right, take it away, Helen.
All right. Okay. So you have a patient that comes into your trauma bay. They are either very traumatic or very septic, and doctor has floated a central line. You started pressors, and or maybe even a post cardiac arrest patient, and doctor says set up for an art line, for an arterial line. You guys are more than capable of doing that. The ICU is always there to help you, but the answer is let's call ICU. That's not exactly the right answer this time. So what we're going to do, here's going to be some of the things that you're going to need. You're going to need a Transpac IV, and it says monitoring kit. So this is going to look a little bit different than your IV pump tubing. Some of our docs, like our intensivists, like to use this extension tubing, and this has hard tubing, and I'll explain the significance of that in a little while. You should, unlike IV tubing, which you can add on extension after extension after extension. With this, you want to only use the tubing. It's about 4 feet long. That's actually that comes with it. You shouldn't add extensions onto this because it could affect your blood pressure. The arterial line is going to sit exactly there in an artery. Okay, so typically we go radial. Once in a blue moon, you could see a brachial artery arterial line, which is just like an antecubital IV. The patient wants to bend their arm, especially if they start feeling a little bit better. You can see certainly where you could have some difficulties with that. You can go femoral, okay, as a physician. Nurses can discontinue a right radial artery, but they shouldn't discontinue from the femoral artery. Okay, that should be the doc's business. All right, so here's what you need. You need this Transpac kit, extension tubing, a 500 ml bag of saline, and you need a pressure bag. So the pressure bag, I know ER nurses, because I was a recovery room nurse and an ER nurse in a past life. I did a lot of pressure bags, but you're going to pump this up once the saline bag is in there. You are going to pump that up to 300 millimeters of mercury. So right where you see the green line. So that's going to be very important. Because we're putting in an artery, we need to put a pressure bag on it to counteract the blood pressure that's in an artery. Hopefully, you will never see a patient with a systolic blood pressure greater than 300. If that is your case, you have bigger trouble than exactly how to set up your art line for sure. Okay, so with that said, this is going to come up and it looks all discombobulated and everything. You may see some preceptors tell their orientees, just put it in the blood pump and just let it rip. Well, the manufacturer does not recommend that. So I'm only going to teach you what the manufacturer recommends, not that I have not done that in the past. Okay, all right, so if you take this apart, okay, it's all paper, so it's easy to tear. Even if you haven't eaten your Wheaties today, it's okay to do. And, all right, and we can just tear this off. And you'll notice there's a couple of parts to this. You have your drip chamber, okay, with a little spike on it. You have your roller clamp, just like any ordinary IV. And then you have different types of tubing. So the top tubing is nice and soft. It's pliable, just like regular IV tubing. The lower part of this is stiff tubing. And here's the reason why this is stiff, because when I put a catheter into a patient's artery, it's flipping it. It's gonna, with blood flow and everything, it's going to zip around. Okay, it's gonna flop back and forth and back and forth. All right. So with that said, it produces what they call sound waves. Sound waves would get absorbed into soft tubing. With stiff tubing, it won't. So that's the reason why we do that. Another part to this is our transducer. So I'm going to talk a little bit more about leveling the transducer in a little while, but this is the electronic part of this, so don't get that wet. But this is going to take your fluid and convert it into an electronic signal, which you're going to see on your monitor. All right. So the first thing that I do is I make sure all my connections are good. Okay, they're good for tightness. If I take a look at this white cap, I can see through it. And the reason why I can see through it is because this is how it was sterilized in the factory. When a doctor is putting an arterial line in, unless it's absolutely dire circumstances, but if you have any type of control, this is a sterile procedure. So they should be in full PPE, sterile gowns, sterile gloves, their bouffant cap, and everything else. All right, but this is eventually going to get changed to what they call a dead ender cap. All right, okay. Now this part here is what we call our stopcock. if I take a look, it's hard to see like with the shadow, but it looks like OFF. Okay, so OFF, whatever way my arrow is pointing, that's where I'm turned off to. So wherever way my arrow goes, that's where I'm turned off to. Right, so that's an easy one. So the first thing I'm going to do is I'm going to get my bag of saline. I am going to have to purge it from any type of air. I think I forgot to do this morning in ICU, but don't tell them. They'll figure it out. All right, okay. So I'm going to just put this. Our policy will clean that off with a little bit of alcohol. And I'm going to put my blunt end tubing in there, and I'm going to just squeeze it. So I'm going to see all the air out of there. And once I see fluid come through my blunt end cap, I'm good. I've established all the air. You just don't want air in there to skew your readings. Now I'm going to spike my bag. So I'm going to spike my bag. All right, and I'm going to hang it up. Okay, I'm going to hang it up on my thing, on my IV pole. All right. So just like any other IV, okay, I'm going to make sure my roller clamp is down just so I don't get runaway fluid, because this air in the line could skew your readings, okay?
Ellen, is it dangerous to have any air in the line if you did do that? Or is it just something that...
a tiny air bubble probably isn't going to kill your patient, but could it skew your readings? The answer is yes. So I take my drip chamber, and I'm just going to put it about half full or so. Now, the first thing I'm going to do, okay, is... I'm going to turn this off. I want to clear this. I want to clear my stopcock. All right. So this is always going to be up. I'm going to turn off. Okay. And I'm going to open up my roller clamp. This is going to be my flush. So this is how I'm going to flush everything. And just wait for it. Okay. Notice how it's coming from my drip chamber at a pretty good clip. And look how she came out. Okay. All right. Okay. I want to make sure there's no air in there. Okay. And that looks pretty good. Okay, and I'm going to switch out to a yellow cap, which is what they call a dead ender cap. That might be another cap. Yeah, thanks. Very good news. Yep, I'll take that.
I got an extra one here in the other pack.
Okay, yeah, good. All right, I will take that kindly from you. All right, sterile. Okay, and then notice this one doesn't have a hole in it, so I want to make sure no air is going to get in here. All right, so now that's all purged and that all looks good, okay? Now I have this bad boy right over here, which is my reservoir. So the reservoirs we're going to need when you're going to look at part 2 of this video, we're going to need this for drawing blood. All right, so when we draw blood, all right, this is going to be our waste, and we'll talk about that more in our second video. But I still have to prime this. So what I can do is I'm going to squeeze my angel clips together and pull back, all right? About 2-3 cc's. You don't have to pull it back too much. All right. And then what I'm going to do is I'm going to flush through. And wait for it. All right. And once it gets through my top here, I always want to hold that on top. I'm going to turn that. I'm going to be able to prime it. I'm going to push this through. Okay. And now I'll be able to prime it. Just because you have primed it, though, and you think you have primed it, make sure you just double check all of your connections for air. So you saw that all come through. Now you see that all looks good. All right. So with that said, we are up to taking care of this. So remember now, well, you need a pressure bag. Why do I need a pressure bag? You also need like a little holder, and then this is a little transducer holder. It's this white one. I like putting the dead ender cap on simply because, and I'll put this right in here right now to follow the camera. All right. I like putting the dead ender cap on because some places will put a syringe on here. Here is my problem with that. We are taking patients all over this hospital sometimes, 2 CAT scan, 2 x-ray, and you got a vent and you got everything else going. And if this would happen to knock up, and trust me, I'm a crazy woman driver, so that's a possibility that I could knock the syringe loose. This could snap, and then you would have to get a whole new setup. So this is always the safest bet to go as your yellow cap. All right, so everything looks good. My next thing that I'm going to have to do, all right, is put this in my pressure bag. So now I'm going to have to just put it in. It's very easy. It fits in just like a little sleeve. All right. Always look at this bag expires in January of 2024. So obviously just look at your expiration date on your bag of saline. All right. And there's a little hook right there that your saline can fit in just very, very, very nicely. And this is going to hang up. All right.
While she's hooking that up, another thing that I want to mention is that you can use 1,000 bag. You could use whatever you have at that moment. 500 is preferable because it's manageable. But you could use
And it
another
fits,
bag of hand.
yeah, and it fits nicer in the sleeve. ICU does have bigger ones that'll accommodate a liter bag. The only thing is, if you put a liter bag in here, you're going to see this big bulge of saline out. If that's all you got, roll with it, but change it as soon as you can. So this bag lasts, our policy is we change this tubing out every 72 hours. All right. That's why a lot of the docs like the extension tubing, because then it's easy. Just you don't have to go right in at the site and change it. A-lines generally last about 3 to 4 days. Some can last a little bit longer, just depending on the patient. All right. So now we have to pump this up. So again, where my arrow goes, I'm off to. All right. And I'm going to start pumping up, and you can see my bag start to go up. It's my pressure infuser. ER, though, nurses, I know I was an ER nurse for 5 years, a recovery room nurse when I had to blast fluids into somebody. Trust me, you guys are used to pressure bags. Okay, so we just want to make sure that we're going to get in the green. One question that I get is, does the patient, get fluid from this? And the answer is yes. It's about 1 to 4 cc's an hour. Not enough to really calculate into your intake and output. At least we don't do that in the ICU, but just enough to keep the line patent with the pressure bag. Okay, so with that said, we're going to go up. It gets a little bit harder. Okay, as you let the closer you get to 300. But I walk past a room in ICU and I can see if I see a pressure bag, oh, we've got the arterial line. So we will also pump this up if you would have to have a CVP line as well. Okay, all right. Just wait till the green comes in. There she bees. So now I'm green. You want to check this periodically. So if you do have an ER hold with an arterial line in, you're waiting for either a transfer to another facility, or you are waiting for ICU for an ICU bed to get cleaned and ready. You just want to check on this before you take them over and transfer them anywhere, that this is completely pumped up to 300. Okay. All right. And there you go, up to 300.